It all starts with a smile. A smile is an emotion. A smile defines you. A smile defines your personality. A smile defines who you are. There is no reason now for you to live with a crooked smile, with a yellow teeth, with a missing teeth. And this is what we dentists help you for. Now imagine a painting. Imagine a painting of a beautiful girl. A beautiful girl is smiling. What is the first recollection you get? Are you thinking about the Mona Lisa? Can you see her teeth? And this is what bothers me.
Thank you for calling Royal Dental. How may I help you?
Good morning.
Good morning, sir.
So what are we doing today?
So the patient is coming in the next 15 minutes.
Okay, then chalo, let's get ready for it. So other day we met a patient and she had come to the clinic. She was in tremendous pain and she was very scared. She had a shoot. She was a model and she had the shoot the next day. And she couldn't even open her mouth. There was a lot of pain in the lower jaw. And even when we were trying to insert the instruments just to check, she was getting scared. Hello, very good morning. How are you?
Not really well.
What happened?
From last 2 days, I don't know, it's paining a lot.
We'll have a look. Okay. So see, based on the x-rays which we have seen and also when I checked clinically, we see that there is some infection there. But don't worry, we can get it resolved. The infection will be resolved. We'll do the treatment. We'll numb that area so pain is not going to be a concern. It will take us few minutes and we'll be able to finish it off as well. So don't worry about it. Okay?
But tomorrow I have a shoot, and because of this pain, it's like paining too much. So I'm not able to talk and smile properly.
Don't worry, we'll get it done today itself. So that made us realize that dentistry is not only just treating that teeth or the tooth, but it is more important to treat the patient, to address their fears as well. What we have to do is we have to put a crown over it, because what happens is once we have a RC treated tooth, it tends to break over a period of time. Okay. We are not going to have any pain or discomfort during the treatment. It will take us 15-20 minutes to do it, and then final crown will be done in a couple of hours. We explained to the patient that how the process goes. It is nearly painless, and as soon as we made the patient numb, she was very comfortable. So are you okay now? Feeling okay? Comfortable?
Yeah, much better.
Great. I realized life is not worthwhile until I take risks. When Dad started, he was alone. So am I today. But I know that somewhere He lies within me. It is that satisfaction that gives us motivation, that drives me. Recollect that time during the COVID. We switch on our televisions, or even when the telephone rings, the fear of that COVID. This is what happened to us during the COVID phase. The first year of COVID, we learnt a lot. We did not switch off our practices. We did not stay home. Every day, my father and I, we used to come to the clinic. We used to treat patients. It was not only for the patients but also for our staff. And after that, suddenly the COVID hit us. When the COVID hit us, it hit us bad. Father was admitted, grandparents were admitted. and due to the other medical conditions of the father, he could not survive. Now when I look back to that time, to that 1 year of cherished memories, I see that he had compressed the whole life experience into that 1 year itself. So much knowledge, so much discussion. It was like doing residency 5 times over. It had been a couple of months since father had expired, and we were trying to build ourselves together in both our family life as well as professional life. And then another instance happened. In our main reception, in our main clinic, there was a spark and it completely burned down. But I remember the story of my father saying that whenever there is a bad instance, whenever there is something which is going to drop you down, it is going to teach you something. There was no other option but to face it bravely. We rebuilt the reception, we rebuilt the consulting, and it was a challenge not only for us but also the staff. They were also demotivated. They had been working with father since decades, and suddenly seeing the clinic burn down also burned their spirit. But I feel at this point it is the togetherness, the royal family, which actually made us better. It helped us rebuild the clinic, and it was done in a record time. It just took us 45 days to again build the reception back to its former glory. So taking a break helps me maintain the work-life balance. When I go back home, play with Ginger, play with my cat, he fulfills that void. When I play my computer games, it helps me reset my mind. And when I paint, it helps me bring out that creative side. During the day, it is the work hours, but that time is my own time. It is time for my family. This is the same thing which I feel whenever I'm swimming, whenever I go deep sea diving. That is also something which I enjoy a lot. With the advances in technology, 3D printing, and creating surgical guides in-house, we are now able to treat even a 90-year-old who did not have any teeth to get full set of fixed teeth. It truly epitomizes our philosophy to do as much as possible for the patient, but do as little as possible to the patient. So what is the one thing which people should know about me? I'd say I have many smiles watching over me. So how are you feeling now? Treatment is done?
Yes, I'm feeling much better.
Pain has gone?
Yes, pain has gone.
Is the numbness also gone now?
Yes.
Perfect. You ready for shoot tomorrow?
Yes, with the confidence.
And once that was done, in the evening when she went back home, she called us the next day and she told that her shoot had gone very well and she was very comfortable. This is what we strive for in our dentistry. This is what we stand for.